Prostate cancer is the most common cancer in men in Sweden. Early detection of prostate cancer with PSA tests is associated with the diagnosis of a considerable portion of cancers that are indolent and can lead to overdiagnosis and overtreatment of cancers that, if left untreated, are unlikely to cause the patient any symptoms or affect survival. Radical prostatectomy aims to remove the entire prostate and thus remove the tumor radically. The major possible side effects of radical prostatectomy are urinary incontinence and erectile dysfunction. Active surveillance is becoming a widely adopted alternative for some men with prostate cancer. Instead of having immediate treatment, men on active surveillance are monitored with periodic biopsies, physical exams of the prostate, and PSA tests. Treatment begins only when the cancer shows signs of progression. The objective of our study was to analyze oncological and functional outcomes 12 months after treatment of very low-risk prostate cancer with radical prostatectomy in men who could have been candidates for active surveillance. This is the definition of very low-risk prostate cancer in the Swedish national guidelines. The LAPPRO trial is a prospective study that included 4,003 patients from 14 participating centers between 2008 and 2011 in Sweden. The study involved a mixture of high and low volume hospitals and surgeons. 338 patients fulfilled the criteria for very low-risk prostate cancer. Data was collected through clinical record forms and validated patient questionnaires administered and collected by a neutral third party. 34% of the men were upgraded to stage PT3 or postoperative Gleason sum of 7 or more. 16% had a positive surgical margin. Being incontinent can affect you not only physically but emotionally and socially as well. Using the definition less than one pad change per 24 hours, the result was that 16% of the patients were incontinent 1 year after surgery. Erections are controlled by 2 bundles of nerves that run on either side of the prostate. In this study, it was possible to save both nerves in 72% and one of the nerves in 16% of the operations. In our study of men with low-risk prostate cancer, 56% had erectile dysfunction 1 year after surgery. Trifecta was defined as those men that were continent and potent and who had no biochemical recurrence or salvage radiotherapy. 38% of the operations resulted in patients with Trifecta 1 year after surgery.
My name is Stefan Carlsson. I'm a senior consultant at University of Karolinska and also associate professor at Karolinska Institute. I'm the first author in this study and I'm going to make some comments. First, the oncological results. Upgrading in 34% of the cases is a little surprising and tells us that diagnosing prostate cancer with systematic biopsies is far from perfect. You have to remember that before you choose active surveillance as your treatment, you should do a multiparametric MRI and a second biopsy after that. And this was of course not done in this study. Secondly, the functional results. From a surgeon's perspective, a man with a very low risk prostate cancer is the perfect candidate for a bilateral nerve sparing surgery and the preservation of urinary and erectile functions. However, from the present study, we can conclude that choosing surgery as the primary treatment for very low-risk prostate cancer will to a great extent jeopardize a man's sexual and urinary health. Finally, I think this study is of great help for the physician discussing treatment options with a patient newly diagnosed with a very low-risk prostate cancer.